and founder of Life and Death Matters. I worked with Victoria Hospice for years, in particular many years on the palliative response team, and I have a master's in thanatology, which is the study of death, dying, and bereavement. I'm a lover of education and a great respecter of direct care providers, especially personal support workers, also known as healthcare assistants, continuing care assistants, nursing assistants, and of course I'm also advocate for nurses as well. I have authored a few resources, including Essentials in Hospice Palliative Care, a practical resource for every nurse, and the resource that we'll talk about today, Integrating a Palliative Approach, Essential for Personal Support Workers. I would like to introduce my esteemed colleague, my fabulous and esteemed colleague, Anne Marie Gilbert. Anne Marie is a scientist. She is a computer geek. She's an eternal student and dedicated to learning all things palliative. We are so grateful for Anne Marie. She's, I think, waving to us there, for her leadership and the incredible work that she does on our team. She will be here today to manage the technology, to manage me, and to help respond to your questions. I have shut my window, but you might hear the Canada geese overhead. The fields just near us the corn has been cut and the geese are in heaven. First of all, before we start, and I am delighted to acknowledge each of you. I wish I could introduce each of you. So many of you I know, I have met over the years. You represent personal support workers, nurses, leaders, educators, social workers from across the country, from east to west, and from north to south. You come from universities, colleges, hospices, communities, long-term care, and you come with an interest in learning more about yourself, your work, exploring ideas and resources for teaching palliative care. You'll include dear colleagues and friends. Some are new names, and later when we can turn on the cameras, you'll be new faces. I will present, and then we'll have time for questions, comments, ideas, and suggestions. I just wish that we were surrounding a lovely campfire or sitting at the edge of an ocean or a lake, swimming and then drying off in the sun, sharing our love for palliative care, education, and direct care providers. We have muted your microphones and turned off your cameras until question and discussion time. And I hope then that you'll be able to feel comfortable to turn cameras on. Please post your questions in the chat, which we will address at the end of the presentation. If you're unable to stay for the entire presentation, the recording will be available at a later point. Now I'm going to turn off my camera as well. I will present the updates. You will see the slides, and then you will then afterwards we will again turn on and have a face-to-face experience. So I'm just going to share my slides. And we will go from there. So welcome, welcome, welcome. So again, my name is Kath Murray. Our goals for today is to introduce you to a few of the key challenges facing personal support workers and to provide you, leaders, educators, and personal support workers with strategies to address those. Our hope is to help students both in the workplace and in core curriculum meet those challenges and to help personal support workers be more confident, competent in providing palliative and end-of-life care, and to announce the second edition of the text, Integrating a Palliative Approach, Essentials for Personal Support Workers. We need a drum roll here. We are thrilled about this. For our outline for today, I will address recommendations for palliative care competency-based education, equitable access to palliative care, and then we will address a few of the needs about retaining personal support workers, adapting education for online delivery. We'll talk about the resources, ordering, pricing, etc., and have time for questions, comments, and connecting. So there has been a call for competency-based education. Why? What's happening? Many of us are familiar with the great Dame Cicely Saunders and her work to develop hospice, which then spread as a hospice and palliative care movement globally. But we have seen many changes in the last decades in the way we are dying, and we have seen palliative care need to evolve globally to better meet the needs of the dying and their families. From the original philosophy and principles of hospice, the development of wonderful hospice programs around the world, the introduction of the phrase palliative care, and in the past decade, the push to internationally to look upstream, to look to the needs of people with non-cancer diagnosis, and to address the needs of those who have been underserved by specialist hospice palliative care model. In 2018, the framework on palliative care in Canada was published with specific recommendations. They recommended that palliative care competencies for all healthcare providers be developed, with a push for early integration of a palliative approach in caring for people with any life-limiting illness, early in disease process, and across all care settings. The provincial palliative care leaders in Nova Scotia, BC, and then Ontario developed and launched palliative care competencies for all members of the healthcare team, including personal support workers. Alberta prepares to launch their competency document in October at an online conference. The competencies identify new content that needs to be addressed for all healthcare providers, including personal support workers, in core curriculum and in continuing education. So as educators now, as educators and as leaders and as personal support workers, what is your work? It is to address the recommendations and help personal support workers meet the new competencies, all within an already full core curriculum and a full to-do list in workplace education. We have felt concern for you as educators and desire to help and support you. We want you to feel confident in leading, and with that have developed the second edition of the text addressing specifically those competencies. This new edition addresses all of the competencies. We ensured that all from each of the provinces were being addressed. One of our goals is to help you feel confident in teaching the material so you can best prepare your students to meet these competencies. Now, I'd like to just add too that there's a national document coming out that summarizes and pulls together those competencies. But we felt that by ensuring that all the competencies from all the provinces were being addressed, then we would be addressing anything that came out on a national level. So what are the benefits for your students? Your students, the hope is that your students, you'll prepare them to face the challenges of providing care for those with increased acuity and increased number of deaths. The hope not only that you would attract more students, but also, if you're in workplace, attract staff prepared and able to, or that you can help prepare to do this work. So let's take a look first at another one of the forces that inspired the framework and the competencies, and again, look at the teaching solutions. The strategies that I'm sharing will not only benefit the students, but will benefit you in the college and the workplace. So equitable access to palliative care. Calls for equitable access and equitable health care. For years, people have called for transformation of healthcare systems to provide equitable access for all people. Healthcare that meets the needs of all people in a culturally safe environment, free of systemic racism and bias. In 2012, the Truth and Reconciliation Commission identified inequities of access to healthcare, including the barriers to care experienced by First Nation peoples, Inuit, Métis, and urban Indigenous peoples. Recently, the Black Lives Matters movement has highlighted the inequalities of care for Black people. But in Canada, this includes Black people, Indigenous, and Asian people. And meanwhile, we are hearing amongst the LGBTQ2 community the inequities and the equalities that they're experiencing. the inequities in care provided to people from minority groups, including older adults, children, marginalized population, and the vulnerably housed. The good news is that these issues are addressed again in the framework for palliative care and in the new palliative care competencies from BC and Alberta. Personal support workers, the competencies that relate to them specifically, as well as to all healthcare providers, these competencies are fabulous. Meeting these competencies, personal support workers will understand diverse needs, the needs for a trauma-informed approach to care, and strategies for a culturally safe environment. If all healthcare providers could meet these competencies, everyone will receive care in a kind, compassionate, and respectful way. And the good news is that your parents, your loved ones, your friends, and community will be better cared for. But what does this mean again for you as educators? Perhaps you are already striving to teach cultural humility, reflective practice that is free of bias and racism, trauma-informed care approach to care, and a strengthening of a First Nation, Inuit, Métis, and urban Indigenous perspectives. We have made it easy, though, for you to teach to these new competencies. The palliative care competencies inspired and guided the writing of this text. The Ontario Palliative Care Network included specific competencies on providing care for First Nations, Inuit, Métis, and urban Indigenous peoples. The combined competencies guide personal support workers to provide culturally safe care with a trauma-informed approach for any person. Our First Nation advisor, Sheila Blackstock, helped us to thread the Indigenous perspective throughout the text, including stories to exemplify their needs. These competencies are woven throughout, so students and educators can see exactly what is expected and what is needed. The feather icon was chosen because birds often hold a role cross-culturally as important intermediaries, messengers, and guides for knowledge. We appreciated a young Indigenous artist, Estrella Wei-Tung, who created this for us. So again, what does this mean for your college? What does this mean for your workplace? The text will help you meet the recommendations from the Truth and Reconciliation Commission to strengthen the Indigenous perspective in all healthcare programs. In some programs, this is a requirement, and using these resources will help you address those requirements. The hope is that PSWs will be more employable because of these skills and will feel more confident and greater satisfaction and less fear. If your student is an immigrant or your staff member is an immigrant, and there is a significant population of immigrant or minority populations working in this field as personal support workers, or if they're part of an underserved, marginalized population, or if they've experienced trauma themselves, they may in fact feel heard, validated, and supported in their experiences. And perhaps they will be better able to identify and address issues of racism and judgment in both their personal and professional lives. So now we'll talk about training and retaining of personal support workers. There is a need for more personal support workers in community and in long-term care and in hospice and palliative care. From a bigger picture perspective, our population is aging. People are living longer, require care in the community for a longer period of time. There are fewer family members available to provide care. There are longer waits for admission to a facility, so people need care for longer periods in the community. There is an increase in both community and in long-term care, an increase in acuity and an increase in complexity. In long-term care, there are shorter lengths of stay and increased deaths in each unit each year. And as Dr. Joanne Lynn describes, long-term care facilities are in fact hospices, but without the budget for resources, staffing, and education. Personal support workers are providing care for increasing complex acute care patients or acute patients. Burnout and compassion fatigue are problems, and personal support workers are leaving the field. In July 2020, a report by the Ontario Ministry of Long-Term Care found that approximately 40% of personal support workers have left the healthcare sector after graduating or within a year of training. 40%. According to Health Force Ontario, 50% of personal support workers are retained in the healthcare sector for fewer than 5 years. 43% of the sector leave due to burnout or working short-staffed, and approximately 25% of personal support workers with 2 or more years of experience leave the sector annually. The report affirms what we've been hearing for the past years, but this has become even more evident during COVID. There is a critical shortage of staffing. There are not enough personal support workers. The ministry report states most residents reach end of life in long-term care. This is not new for those of us who have been working in palliative care, where we often say that human beings are mortal, that life is terminal, and I like to joke that it is sexually transmitted. But somehow in the long-term care sector, we have neglected to talk about this adequately. Staff suffer the emotional cost of providing care for multiple deaths, supporting family, and grieving for those they have provided care for, all without realizing that in fact, this is the work they are doing. In July 2020, the report again acknowledged the need to more fully acknowledge personal support workers as full members of the team. So the quote is, despite being critical to the success, they are often not acknowledged as full members of the team. And one phrase that is sometimes used is are treated as second-class citizens. So how do we retain? The recommendation is to educate personal support workers on self-care, to fully integrate personal support workers into the team, to provide personal support workers leadership opportunities, and to support ongoing personal support worker education. I am thrilled that there's so many, or that there are many people who registered today, some who are personal support workers and who definitely are leaders and advocates for personal support workers and for palliative care. I'm also acknowledge those who are here today that are looking at providing ongoing education, as well as those who are here looking at core curriculum. So teams need to fully integrate PSWs into the care team, help draw on their perspectives and knowledge of residents in care conferences and care planning. Need to explore leadership opportunities for personal support workers, such as mentorship and preceptorship roles, education, and peer-to-peer support. I love this illustration. The personal support worker is walking into a care conference, equipped with notes, having gathered information, using standardized tools to help present the information about the resident to the care team. So what does this mean for you as a PSW educator? Your challenge then is to prepare PSWs to care for themselves, to collaborate, to provide mentoring leadership opportunities, and to continue providing continuing education. This means you need to keep on doing the great work you are already doing. Way to go. In addition, I'd like to talk about some of the resources that are in the text that might be of value to you in addressing these issues. So the chapter on self-care, and more on this in a minute. Also, personal support workers need to understand and use tools so as to fully participate in the team. We have added in a chapter 3 titled Using Standardized Tools. Examples of tools that will help the PSW to participate fully on the team include things like the symptom assessment framework and the SBAR communication tools adapted for PSWs to gather information from the person and then communicate that information in a clear way to the nurse leader. I have said for years that the further away the nurse leader is from the person, the better report that report needs to be. So whether the person is far away because they're busy, because they don't know the person, or because they're across town. We need to provide support workers with the tools so they can contribute in team discussions. The chapter on best practice ways of being and best practice in supporting, providing comfort, communicating, and collaborating on the team. The chapter on last days and hours addresses not only the physical needs of the dying person, but ways to support the family and loved one through the decline, dying, and bereavement. Often support workers say, caring for the dying person is easy. It's how do we support the family? These tools provide good support and suggestions for responding to questions and communicating those again with the team. In the workbook, there are opportunities to develop self-awareness in each chapter. An example, in the section on psychosocial issues, students can reflect on their preferences about advanced care planning and explore ethical issues surrounding medical assistance in dying. How incredible to address these issues in a safe environment with mentors, with instructors to help them address personal and professional issues related to loss, grief, dying, and death. And I've so appreciated over the years hearing stories of students who have experienced death in a clinical setting, in a personal setting, and who have been able to then address those throughout the PSW program and have been able to deal with some of their anxieties and their concerns before having to go into clinical setting or outside of clinical setting. Continuing education provides the opportunity then also to provide continuing education through online courses. And we're excited to announce, separate from this, that we are going to offer online education and a certificate specifically for personal support workers. With these resources, the hope is that the person will receive the care, they will receive even better care, and that the team will better understand the vital role of the PSW on the team. But hopefully this will also increase the job satisfaction for personal support workers. And in the longer term, we hope this will increase the likelihood of PSWs staying in the workforce. So a few examples from the chapter on self-care. This is a check-in, an opportunity to reflect for signs of compassion fatigue, and as an example of one of the courses. The research is indicating how important it is that people have a self-care plan, a holistic self-care plan addressing their physical, emotional, spiritual, cultural issues, as well as looking at relational and professional strategies. Indeed, ideas for ways to create for themselves and to care for themselves as holistic beings. In the workbook is a challenge activity to create maintenance self-care plan, as well as a second plan to use in times of emergency or crisis. Wouldn't that have been helpful for people over the last months as we've experienced the COVID crisis? So again, what does this mean for your college? The good news is the competencies include providing care for the dying person and family. And we can better provide graduates that are more involved on the team and more likely to stay. Wonderful validation of the college and of the workplace as an institute of learning, and your role as outstanding educators. So let's talk now about the need you've had to move, many of you, both in the workplace and in the classroom, to online learning. Since March 2020, many colleges had to halt in-class learning. Some had to stop their programs altogether and are just now reviving with a hybrid model. I have seen educators across Canada in the nursing programs also go into high speed, moving entire courses onto online platforms, not knowing what the heck they were doing, and trying to develop creative ways to complete lab requirements and practicum requirements. All of our resources are now available online: the textbook, the workbook, the podcast, the videos. What does this mean for you? Convenient access for students 24/7. The media resources, the podcasts, and the videos. So the podcast being auditory, we know that much more now than we did 10 years ago when we started presenting these or preparing these, and the videos. But originally we developed these for use in a flipped classroom model where students could listen to the lecture content and then come to class and discuss it. But this has in fact become the norm that we have online learning. Guided self-study tool is in development again for this new text and will assist students to work through the materials independently and in small groups, online or in face-to-face sessions. So our hope is that for you as educators, that you can use these resources and integrate them easily in a hybrid model where you have both online education as well as face-to-face. A bonus that we're excited to announce is a palliative care certificate for students. So for schools who integrate the full set of Life and Death Matters resources and follow the instructor's guide, we are pleased to offer a certificate that your students can receive when the school has fully integrated these. So students can then graduate with, for example, their food safe, CPR, gentle persuasive approach, palliative care, etc. So I'd like to just summarize a bit about the resources and some ordering and pricing information, and then open time to questions. If you've not used our resources before, you might not be aware of what we offer. We have two main packages: the Essential package and the Essentials package online. And that package includes the hard copy package includes print copies of the text and workbook, as well as 1-year access to the digital text and workbook, as well as podcasts and videos. The online package, only online, provides access, 1-year membership to the digital text and the workbook, and the podcasts and the videos. Now, concern about, is there a really big price increase? We're offering a 33% discount as an introductory offer, and so there's only an increase of $9. And when introductory pricing ends, the colleges will continue to receive a 20% discount for bulk orders of 10 or more packages. And the online package continues to receive a 20% discount for bulk orders of 10 packages or more. There are no changes to ordering. There's convenient online ordering, and please at least 2 weeks in advance for, allow at least 2 weeks for delivery of orders. No additional time is required, though you'll need to just tweak, and we can work with you to tweak your outline. You'll see the new instructor's guide. Students can access resources outside of the classroom as well. So if you're short on some of the lecture time, then some of that can be assigned. So I'd like to now open the time for addressing any questions and comments. And I'm just going to stop sharing.